Tips for tinnitus relief for hypermobility. Tinnitus is, in general, it's that ringing in the ear that people have, and it doesn't matter if you're hypermobile or not. That's a common problem. Hi, I'm Dr. Shakib from Hypermobility Therapy, right here in Irvine, Orange County, and my practice is all about hypermobility. So let's explore about tinnitus. So when it comes to tinnitus, hypermobile or not, as an individual that works on joint hypermobility in general and biomechanics, I can tell you that there are certain areas of the body that I go to. I always go to the neck. I always go to the temporomandibular joint because there is a correlation of the two. The posture, your posture makes a difference when it comes to tinnitus or ringing in the ear. So, one of the things that I want to address is obviously when it comes to hypermobility, we want to address the joint instability, which is a process. This is not you do this exercise and then all of a sudden your joints are stable. Uh, how to connect the dots, how to activate the right group of muscles to work together so you don't feel that instability, you don't feel that tension in a specific area of your body all the time, where you gotta stretch it beyond what stretching should be just to get that relief. That's all of those things make a difference. When it comes to the TMJ, your head over your neck and your neck over your body, that connection, that complex plays a big role. We want to work on the posture. We want to work on biological breathing. Biological breathing is what we all did as babies. We all started as babies that we could hardly hold our heads up, and we became running toddlers. No gyms, no bands, no weights, nothing. And somehow we stabilized our movements and our joints so well that we were able to move. So, those same exact breathing patterns by studying human babies is what we want to do. Those are the same exercises that I do with my patients. Those are developmental exercises I do to not only improve the posture, but to also stabilize the joints, which is so, so crucial when it comes to joint hypermobility. When it comes to tinnitus, specifically, so we were working externally by working on the posture, by working on the breathing and doing developmental exercises with the patients. We want to kind of keep the stress down. We want to make sure that, oh, another thing I forgot for external thing is I heavily work on instability of the head over the neck, because that's a huge player not only with tinnitus and dizziness, but also for a lot of headache issues. So, going back to managing stress, so we want to make sure that we're addressing the activation of the right muscles in the head and neck. In addressing the tinnitus, we want to kind of have those. Um, have some kind of a noise. Typically, it's a pink noise or white noise or brown noise that we want to have to just kind of calm down some of that ringing that is going on. And also, cromolyn drops seem to be very helpful when it comes to tinnitus. What percentage of my patients have tinnitus? I would say, well, of my hypermobile patients having tinnitus, I honestly don't see any more difference with so drastic of a change in my hypermobile patients with um, tinnitus versus the ones who are not hypermobile. What I do see is that the level of instability of the head over the neck and their posture making a huge difference in the ones that do have tinnitus. So once we work on stabilizing the joints much better, we see clearing of a lot of other things that come along the way. So essentially, that's understandable because a lot of the signs and symptoms that hypermobile individuals have and complain about are directly related to how active they are and how they move about and how stable their joints are. As we start correcting those things, these other signs and symptoms, including tinnitus, uh, start improving. If you have any questions, please make sure that you comment below. Make sure you follow me and subscribe to the channel. Turn on the notification bell just so you get notified of any future videos that I do. And until next time, take care.